Welcome. This is GDC Live, a chance to hear from people who are leaders in their industry who are working to inspire change in the world around them. I'm David Ocamb, the Chief Research Officer at GDC Marketing and Ideation. Whether it's click it or ticket, child passenger safety, safe and sober driving, speeding, or distracted driving, GDC has partnered with states across the country to share messages that save lives. Today, we're talking with Dr. Darrin Grondel, the Vice President of Government Relations and Traffic Safety for the Foundation for Alcohol Responsibility, or responsibility.org. Today, we're going to talk about driving while impaired on marijuana and other drugs, enforcement, and some of the challenges that the current COVID world brings.
So Darrin, thank you for taking the time to join me today. So for anyone out there watching this right now who may not know who you are, can you take just a brief minute to kind of go over your background and how you came to the position you're at today?
Well, thank you, David, for having me on the show. My name is Darrin Grondel. I'm the Vice President of Government Relations and Traffic Safety for the Foundation for Advancing Alcohol Responsibility, or responsibility.org. My career started in 1992 as a young baby trooper coming out with the Washington State Patrol. I was assigned to Seattle, and then I served in a variety of capacities. And then in 2017, I retired from the Washington State Patrol as a captain. And at the same time, I was also working as the State Highway Safety Office Director. And so the State Highway Safety Offices are in all 50 states and all the territories. And we help facilitate federal funds to the local agencies and programs to address traffic safety programs. In the states, it could be from law enforcement, prosecutorial, it could be toxicology, treatment, probation. So we did a lot of work around traffic safety. And then on April 1st of 2020, some people thought, man, it's April Fool's Day, it's COVID, are you sure you want to change jobs? And I had the great opportunity to come over to the Foundation for Advancing Alcohol Responsibility. I believe in our mission, which is eliminating underage drinking, eliminating impaired driving, and then responsibility for alcohol choices. And so for me, it was an opportunity to come over and be a part of something much bigger than myself and to help support the elimination of impaired driving. So that was kind of my background a little bit. I also, educationally, I have a bachelor's, a master's, and I just recently received my doctorate in organizational leadership from Brandman University in organizational leadership. So the academic and the professional background has kind of led me to this point where I'm at today.
So let's go back, because in Washington State, the time period that you were working is such an interesting time period to me. It's one of the biggest, most interesting test case, I guess, in the traffic safety world out there. Can you tell me a little bit about what it was like to be on the front lines prior to legalization of marijuana, and then during the debate and as it was going forward, and then frankly, as it was unfolding in front of you and as it was unfolding in front of your eyes? I'd be really interested to hear what it was like there, right? Because there's so many states out there in the country. Texas, I'm sure, is one of them where that issue is coming up, and that issue is very real. The recent election showed, was it 4 or 5 states just legalized? It's a very pressing issue and a very poignant issue, and Washington really was one of the first test cases.
Yes, so in 2011, I was working in our commercial vehicle division, and I was our division commander. And so, we'd heard peripherally about the legalization, but in 2011, the initiative had failed. And at the same time, privatization of alcohol sales was approved by the voters in an initiative. And so at that time, I really didn't think that marijuana legalization for recreational marijuana would pass. We thought more that the medical piece would be more, vetted and addressed with some statutory language more around that piece. But then in March of 2012, the governor appointed me as the State Highway Safety Office Director. And so here I am coming in as a brand new director, and almost 8 months later, this initiative passed.
Oh, wow.
The interesting thing, and that was Initiative 502, which legalized recreational marijuana, and that passed in November of 2012, that in essence legalized it for December of 2012. However, you can imagine with trying to put regulation, a regulatory agency, what are the programs and policies in place, it took almost a year and a half before that actually took place. So first sales began in July of 2014. But to kind of back up a little, as a state highway safety office director, as appointed by the governor, as a state agency, we weren't actually able to do anything as far as speaking out or addressing the initiative. And so that became a very complex issue for us as well. The other challenge was that there was no funding available for messaging or education. But the initiative, when it was signed, it approved the Liquor Control Board. Now remember, in 2011, it was privatized. They lost 1,400 employees right off the start.
Oh, no.
And so from that, then they were then named in the initiative to be the regulatory agency in 2012. And so, you know, as states and as you consider for states that are legalizing is who would be that regulatory agency? Who would be the one that would look at policy? Who would look at enforcement to make sure that it's done correctly? From the growers to the wholesalers to the dispensaries or the cooperatives, whatever they deem those in those states. So then it was, you know, then what's the impact, especially for our conversation and for mine at the time was, how does this impact impaired driving?
Absolutely.
The question was, if marijuana is so dangerous, where's the bodies? And you know, for a lot of the state highway safety offices, we were looking at impaired driving cases and you know, as far as arrests and fatalities, serious injury. And so most of that affected and looked at alcohol. And so I think this was a time period where it really looked at some of those gaps that we had in our own data is what is the true picture? And we had, you know, lots of drug driving fatalities. But because of the way some of the systems were working at that time, there were certain national databases that only took 3 drugs from the toxicology screen. That has since changed. And you may have 7, 8, 9 different drugs in the tox screen, but you could only put in 3. So then we wrote a letter and asked for that change. And it did take place in 2018. But at that time, you know, when you're only able to say there's only 3 substances, that really we had to go back. And I had my entire research and data division go back, pull all data from 2018 and record every substance that was on the toxicology screen. Now you have to be careful because some of those are metabolites of the same drug. And so you have to be careful with how you do that. But ultimately is looking at multi-substance impaired driving. And it had been around. We had known that. But we noticed a significant increase now looking at the increases. Now, we may have had 7 fatal crashes with cannabis only in the system. And I think it was 2016, 17, we started seeing that number creeping up. And it was almost 30. Now, just mind you, that's just cannabis only. But our number one fatal or our combination in fatal crashes was a combo of alcohol and cannabis. And those have a synergistic effect. You know, we don't have any science to show what that level would be. At that time, that was in our initiative, the public voted on was that there would be a 5 nanogram per se limit. So it would be presumed that if you're over 5 nanograms, you were impaired. Now, there is no empirical evidence. There is no science that shows what that impairing level is for cannabis. And one of those lessons learned for us, I think for me as a highway office or safety director is don't put a per se limit on it.
Absolutely.
It really should be able to be identified through impairment because there might be some that are 5, 6 nanograms and they show no levels of impairment.
Well, and did you guys fund, sorry to interrupt, but did you fund additional DREs, which is a drug recognition expert, law enforcement that are trained in detection through the legalization, or was that later on, or has that even happened in Washington State?
Could you rephrase your question? I wasn't sure I followed the first part.
Yeah, so was a funding mechanism put in place to provide proper training to law enforcement to become DREs and be able to identify impaired marijuana drivers on the roads and during stops?
Yeah, at the time, my office had been paying for the Washington State Patrol's impaired driving program that handled the drug recognition experts. And we had paid for multiple DRE classes. The initiative did not provide any funding to the State Highway Safety Office. Now, that was in Washington. However, Colorado, they did get money. California has implemented that as far as they get quite a bit of money for research, training, education, that kind of thing. So that's another, and I think a key point for states is making sure that if you do legalize, that there is money to address some of the fallout that comes with it. That is something that you need to look at for either the taxes through the legalization or whatever it might be.
And so we've talked a little bit about the 3 E's that we all know in the traffic safety world: enforcement, engineering, and education. We've talked a lot about the enforcement side with the DREs. Mm-hmm. Let's go into the education side for a second. Did Washington State conduct any research on attitudes and awareness of the population of marijuana and the impairment and driving under the influence of it? The reason I ask is the Texas Department of Transportation, where GDC has done an extensive amount of work, we actually conducted a project on their behalf into attitudes and awareness. I think I was able to share that with you recently, and it's been extraordinarily eye-opening to me of what is really happening on the Texas roads. And I'm curious if Washington had a before and after snapshot to see if things changed up there.
So we did not. As noted earlier, we did not have any funding to do that. We tried to pivot on a couple of projects to see if we could actually get some attitudes, the beliefs of the public on this, but we weren't able to at that time. However, we worked with Montana State University on a traffic safety culture project. Yep. And one of those is, what's the attitudes of the public in Washington State on cannabis and alcohol? And instead of saying, like you might hear is, well, everybody in Washington's, driving high. Well, from the research and the data that we derived, it actually showed that almost 90% of the public said, I would never drink alcohol and use cannabis and ever drive. So the message actually could change to, Washingtonians are 90% likely not to drive and, alcohol and cannabis consumed. What we learned from that too was that there was a certain portion of the population that said, if I get really high, I can drink alcohol and it'll reduce my impairment.
Oh, wow.
Yeah, that was something that we learned. And that's where it's really important to be able to see where those attitudes, those beliefs, kind of the values that you might have, because that's really what makes up your culture. And when you look at that traffic safety culture, is what are some of the messages that you need to address? For instance, the proponents for legalization at the time were, it makes me a better driver. I slow down. I'm zoned out on the road. I'm not as aggressive. Well, cannabis does not make you a safer driver. There is no drug that makes you a better driver. Mm-hmm. If that was the case, as a state highway safety office director, I'd be selling those vitamins all over the place. But that doesn't exist. And then as far as slowing down, we've also seen research that was conducted through the DRE program. And there's an actual research document that's out there, and I can share that with you, but it specifically shows that when cannabis is the only substance on board, what is the number one reason for the stop? And the number one probable cause was speed over legal. So it does not necessarily, you might slow down up here, but are you actually slowing down out there? And so the other element of this is maybe not driving as aggressively. That might be true, because you're a little more mellow. But are you able to react to sudden changes in the environment? Something coming across the road. Do you have the ability for the depth perception, the reaction time? I mean, there's time and distance. There's a lot more to it than just, I'm not driving aggressively or I'm not driving as fast. And then if you do slow down, especially if you're on a highway, then if you're slowing down, then do you actually become more of a risk slowing down because you're now at 50 in a 70 zone? You actually become more of a greater risk. So there's just some things to really think about. There's no evidence to prove or show that it changes your driving at all.
Yep. And so you mentioned that you joined FARS right at the start of COVID, right at the very, very beginning. And so I think that a lot of us in the traffic safety world, I'm sure you guys probably as well, felt that at that very beginning, this is going to be a banner year. This is going to be the safest traffic safety year ever. And NHTSA, with the study that just recently came out, has debunked that this is not on track, especially if gone by vehicle miles driven, to be a safe year whatsoever. And in terms of that study, and I kind of want to get a little bit into it, in terms of what they're discovering in people's bodies whenever they're in the emergency room for serious injury or fatal injuries. They're looking at the toxicology and discovering people are on opioids, people are on marijuana, people are, and alcohol involvement is up, speed is up. What's it been like working with FARS during this time period of dramatic and serious societal change, and in my opinion, towards the negative when it comes to traffic safety?
Working with FAR on this has been very, very, and then with the federal government, this is very concerning to us because the stress, the issues related to COVID, the stresses of being at home, we're kind of on lockdown, the stresses of the disease and its implications. I think there's a lot of people that are self-medicating. And,
absolutely.
And they're also, if I don't have to go to work today, or if I don't have to drive, then maybe I'll have a shot at lunch, or maybe I'll, or they have other issues. And so when you're looking at this whole picture, it is very concerning to us. And then how do we address that? How do we help with that piece? So, and that's what we talk about with responsibility.org is, what is that responsibility? Even though you're home, are you consuming more? And why are you consuming more? Are you mixing those with other substances where it says very clearly, do not consume with alcohol or mix with alcohol? And so, but there are, I think, a lot of issues as far as some of the mental health issues. There are substance abuse problems. And then if they're at home, do those get exacerbated a little more than they would if they were actually working? And so, I think that.
Oh, go ahead. Sorry.
So I think that there's a lot to be considered there. And then you mentioned, with NHTSA's release and saying that based on the data sources that we have, some of them are open source and some other things that are kind of, it highlights to me a greater need that we have to address data systems. Because how do we improve and actually address trends more real time if we don't have data that we can gather real time? And I know that's quite a bit of work that needs to go into that, but that's a question I think for our policymakers for funding and looking at traffic records data is how do we prove that so we can make more real time changes instead of getting something that's 2 years old and then trying to make those corrections. And so that's another key piece that we really need. The data that they show that the increases in fatal crashes. There was a state yesterday, I don't know if you were watching the Governor's Highway Safety Association's webinar on speed, too fast for conditions.
Yeah.
Great webinar, great concerns that we have related to that. Now, what's interesting is one of the states said right now we've seen almost a 10% increase in our fatal crashes. And also in yesterday's news, in that same state was a driver that was coming from Utah, and he was driving through the state of Missouri, and he was caught at 130 miles an hour. He was under the influence of LSD. He had Adderall and some other things, according to the news clip. So it isn't just one substance that we see; it is multiple. And it's having an impact. So is the increase in speed, one, because there's fewer vehicles that are out there and they feel like they can go faster? I think that's probably part of the case.
Mhm.
But is it also, I mean, there was data that indicated at one point that almost 42% of DUI arrests were probable cause was speed over legal.
Mm-hmm.
So are all some of these cases not just, because it's on our open road, but because they are impaired? It just begs the question. So then you look at those states and the challenges that they have in addressing traffic safety. And that's where we've tried to provide funding and resources, some tools, some actual projects that we've done with states that will help them to address some of this. Because when you really think about traffic safety, it can be extremely mind-numbing at times, because there's so many things and so many nuances. And so for organizations like ours, our whole point is, how do you eliminate impaired driving? Not just reduce, but eliminate.
Mm-hmm.
And that really comes down to prevention. And it comes to the education piece. It comes down to an enforcement piece. It does end up with prosecution. Proper assessments that are done on drivers, putting them in treatment, and some other things. Mm-hmm. So, but to your point, the question that you had too was, there was several trauma centers that had been examined as far as what had been coming in, and the number of increases pre-COVID and during it's very concerning on all those cases. Almost for prescription medications, for illicit drugs, alcohol increases. Yes, all very concerning.
We need to, as a community, come together on this. And that's part of the reason that I've asked you to come on today, is because Responsibility's been doing so much amazing work and leading the entire efforts when it comes to drug driving, poly use, all of the things we're now facing in this world.
Well, David, thank you, because I'll tell you, we are funded through the leading distillers in the country. But they recognize that the issue is much more than just alcohol. And Absolutely. They have been willing to at least address provide some resources to look at the whole picture, 360. Mm-hmm. A lot of times officers may have alcohol on the breath. It's really easy to get a breath test and then prosecute. Mm-hmm. But what we're failing to do through the process is we're failing to see individualized justice. And it's not about the prosecution. It's about, if they have a co-occurring substance abuse and a mental health disorder, mm-hmm. are we not taking care of that? We have seen just in some of the research you've done, increases in stress, increases in anxiety, social media, some of the, like our youth, that they're bombarded all day with, am I liked?
We all are. That's not even the youth. That's you and I. That's everyone. And the way it amplifies up stress. I've joked, and I think it's actually kind of serious. After this is over, we need a group therapy session. We need to come together and have a group hug and hug it out. Because right now, these times are tough, and people aren't taking the time to breathe and to heal.
Yeah, absolutely. And that's where, we see a lot of challenges right now. Is, are people being habituated? Are people finding other ways to deal with that stress and anxiety because they lack that human interaction? So then, if that's the case, and then they're now they're now taking it from home to on the road, what are the tragedies that we're seeing? And so the trauma report that we saw that was released, very concerning, especially around the opioid use, cannabinoid use, alcohol was up, and then also the multi-categories up from 18 to 23%. So those are indicators. I mean, that's 5 trauma centers, but it also is kind of an indicator. We have a much deeper issue that we really need to get to the root cause of. And that's kind of where we come from is, it's not just about, making a DUI arrest. It's about the whole DUI system, from education, messaging, the DUI arrest, the toxicology screening, the adjudication. But then what about treatment? What about probation?
Yep.
Because, as a young trooper, I used to tell, I would tell folks now, as a young trooper, I'd go out and make my DUI arrest and say, yep, I'm saving the world because I got them. And then you realize that, yeah, you got them off the road for that time span.
Mm-hmm.
And if they're multiple repeat DUI offenders, and we're not addressing the root cause, then are we derelict in some of our own responsibilities within our states, within the courts, without dealing with the more human element that needs to be addressed? And, and then the impact too is it's not just about the driving, but if we can help them with this, do we help with reductions in DV arrests and DV incidents, other types of crimes, theft, robbery, so that there's more of a quality of life overall, not just about DUI.
One thing that you just touched on that's super interesting to me is the link between increased traffic enforcement, because from what I've heard, and you obviously know this firsthand, a lot of our law enforcement heroes who are out in the field have a bias against traffic enforcement and is seen as a less than form of policing, and you want to get into other kinds of units. But from what you're saying, and from what I've heard from other people too, traffic enforcement is one of those key contact points that decreases crime across the realm, where all forms of crime are decreased if you increase traffic enforcement.
Absolutely. Do you remember how Timothy McVeigh was identified?
It was a traffic stop up in Oklahoma.
Didn't have a front license plate, had some other issues with the license, ended up he was in jail, but that was a traffic stop. There's a number of stories that, criminals use cars to perpetuate crime. And so making traffic stops, which is very important. One is for deterrence for people to violate the law. But number two is we don't want people that are on the roadway that have suspended, revoked licenses, that are impaired, that are repeatedly taking chances and basically saying to the public, we don't care, out there. We want them off the roadway. And so it isn't because fatal crashes do not discriminate. They impact every community, every level of, rich, poor, anybody. And so that's why it is so important that we do not take our eyes off the importance of addressing impaired driving. And especially with traffic stops, this is incredibly critical. I've heard some communities saying, well, we're going to just do traffic with civilians. And how many officers are killed in traffic stops? I would not want to put a civilian out there without some type of a firearm and training and all of that. That just is a recipe for disaster. And so the critical thing is having officers that have the skills, the knowledge, the abilities to address the traffic stop, articulate what the probable cause is, and then being able to effect the arrest or to let the driver go. And so, that's what we have done with some of our grants that we provide for states is good standard field sobriety test training. That's fundamental, foundational for them. Then advancing them to the advanced roadside impaired driving enforcement. 16 hours of additional training. They get more things of identifying drugged drivers. And then the next level is a drug recognition expert. And so helping them to have those resources, because you just can't have enough DREs in a community. So having officers that are trained in A-RIDE, and ultimately the A-RIDE officers were, that program was designed to then feed these folks to the DRE. So it wasn't that the A-RIDE was supposed to take over or supplement for DREs, but that's what we're seeing in some states. So it really should be, hey, we need to call a DRE. I'm seeing drugs and I'm seeing this, that. There's some other indicators besides alcohol or whatever. And then getting the appropriate evidence and then moving forward. It's just holding people accountable.
And I think that we've seen historically, going back throughout the 1980s, we really did see us come together as a society. And I think that we certainly need that moment today. And I think that we are at a turning point, one of the pivotal times in history where moving forward, we as a traffic safety community have to do something to create that moment moving forward. Your organization is one of the leaders in that movement. So fundamentally, I guess the question I want to close with today is, in your dream world, if we want to achieve Vision Zero 5 years from now and say we are not going to have any fatal crashes 5 years from now, where do we start? What do we do? What should we be doing today?
You know, a lot of things are in place right now, but are they enough? The data systems I mentioned at the beginning of our call, that has to be improved. How do we fix something if we don't really know where the problems exist? And, you know, in some states, it's great. In other states, it needs improvement. But as a nation, how do we address that? How do we get Congress to then fund programs even more, especially around the impaired driving piece? We've seen opioid crises. We've seen now with legalization. There's a lot of issues that come around that. Now, we don't take a position on legalization. It's just, if you're going to consume, don't drive. And if you're going to legalize, then make sure that you're putting the process in place to address impaired driving. But data systems.
I'll actually add to that, because I think it's an important note. People tend to have a bias saying that until we legalize, there's not a problem. Once we legalize, the problem could come. What our research has uncovered is it's a problem today. Pre-legalization, It is absolutely a problem. People are dying on the roads because of this problem. And so we can't wait to move forward. We can't wait to address it.
So I think that you look at data systems improvement. One of the challenges is, what is the science telling us? Why are there per se limits in certain states, and the variations, you know, kind of this patchwork? What is the actual science telling us about that issue? The other is how do we employ certain technologies, you know, either vehicle technologies that prevent the vehicle from starting, or from allowing, or actually for roadside enforcement that'll help the officer make better calls roadside. And so, such as oral fluid testing, you know, they have iSign type testing that they can use and capture. There's those kind of things that help with the actual identification and the prosecution of these DUI cases. I think that one of the big things too is, you know, we can spend a lot of money on enforcement and that, but what I think also needs to be just as focused is, now that they're going into court, like with DUI courts or DUID courts, is are they getting the proper assessments? Are they only getting an alcohol because they had alcohol in the breath, but they may have a substance abuse issue? Or are they doing both at the same time? Does this person have an alcohol or a controlled substance issue? And also, and I'm not here to do a sales job, but we do have an assessment. The computerized assessment referral system is called CARS, and it's free for any of the courts. We've made it available through our organization for that purpose, but it allows them to do the assessment for alcohol, controlled substance, and mental health. But then, so what? Then do we have the funding and the resources to help them get into this kind of a treatment pipeline to address that? So another piece is insurance companies. If they have insurance and there's an issue, do they have, does the insurance industry provide them with enough visits to help them get through that? Or are they limited to 4, 5, 6, and then it stops, but yet they need 12 to 16, maybe 18?
Right.
So those are, you know, and that's not a finger pointing. It's just, if we're going to be serious, let's take some looks behind the surface instead of just making an arrest and going to jail, because that just, you know, there's no change in the shame place. So when they feel that shame, they end up going back to drinking or going back because they don't want to feel, you know. And I had a son that was kind of in that realm where he had a substance abuse issue, and he says, "Dad, I just don't want to feel." And so now he's clean and he's you know, he's, yes, thank heavens. And so I've been through that, and I've seen, you know, an area that I never thought I would ever see before, but I had a reality check with that. I think that one thing too is helping officers in identifying. So we will be releasing a publication called the Green Lab. Well, for us, it's the Green Lab monograph, but what it's called is the Cannabis Impaired Impairment Detection Workshop Handbook. And that's in conjunction with the National District Attorneys Association on giving states kind of a roadmap. If you were to do like a wet lab with alcohol, and you've have different people at different levels go through the tests, do the same with cannabis, so that officers can see real time what this looks like. But we can't be myopic just on cannabis. We've got to really be looking at the whole picture.
Oh, yeah.
Because now that legalization's about us, what we found in Washington is that our poly substance use went way up, because it was almost like, well, if cannabis is legal, then why isn't everything else, like now in Oregon? And so so those are things that we started to see as that multi or poly substance use amongst drivers, which was very, very concerning.
And even prescription drugs presents an especially interesting problem in that, A, you have the polyuse problem of what happens if you're using an opioid and or a benzo class depressant, and then combine it with alcohol and the amplifying effects that presents, as well as people who just were not informed by their doctor or pharmacist or anyone along the lines that Xanax that I told you to take actually impairs your driving. What's terrifying to me, frankly, is we were conducting a focus group down in the Houston area, and one of the respondents in the focus group commented that her doctor prescribed her Xanax in order for her to be able to deal with the stress of driving in Houston. That level of thing is happening with prescription drugs, and impairment does not seem to be mentioned. We've launched a TV spot in Texas, and we're working very hard on that problem because it's a very serious problem right now. It has so many different facets, right? Because you have the polyuse problem, as well as in our target demo for prescription drug impairment, when we actually did the research and regressed it out, is middle-aged women, believe it or not, which is not. If you as an officer had pulled over a, let's say, 43-year-old married mom, maybe no kid in the car because she dropped him off to soccer, would you think impairment at that juncture?
Not typically.
And yet that's our chief impaired person. They're driving during the day, not necessarily at night. It's a whole new world, right? And so that's, I think, another equally important problem that we really need to focus on. And impairment is still alcohol, but impairment is so much more than alcohol. And I think that's what we as a community need to come together with, and why I commend you guys so much for bringing that conversation to the forefront.
So one thing you just mentioned, and I'll just throw this out for your audience to think about too, is when we legalized, what we started seeing is more daytime DUIs than nighttime. Because just like you were saying, people were using them more daytime. And we heard lots of folks saying, yeah, I can't stand my boss, or my work is so stressful that I consume before I go so I can get through the workday, and other things. And so they were actually using right before they left their home, and then they would go out and they ended up getting stopped for, driving over the lanes or, whatever it might have been for the probable cause, and then they were arrested. So daytime, our agency is looking at their data to determine if they're having more daytime DUI crashes or arrests, do they have the DREs actually scheduled at the right times? Right. And those kind of things. So that's where good data systems, again, come back to the data kind of drives your narrative. It drives strategy. It drives policy. And so that's where I kind of really think that's another area that we really need to enhance. Like I said, some states are way ahead of others, but overall, how do we enhance that ability? Because we do need to come together as states in this fight, because just because it's legal in one state doesn't mean it's not happening in Texas or others, because it is. The data's
just
there.
To pitch out to TxDOT on the data collection side with Chris, they have really revolutionized things. They're doing things the right way, I think, in Texas in regards to data collection. And there's obviously work to always be done, to always constantly improve and always constantly make it better. But I think they really are one of those best practice states when it comes to data collection, and something that we all should look on to.
Yeah, so there's some really good things there. Under responsibility.org, our website, We have a whole section there on eliminate underage drinking. We have a program called Ask, Listen, and Learn, and it was designed particularly for younger children and adults to talk to their kids about alcohol. Mm-hmm. We just added a new module to that addresses how to speak to them about cannabis. Mm-hmm. So that's underneath our website. And then you have a tab, Eliminate Impaired Driving. We've got a variety of resources. So, when you think about the time that for evidence collection for alcohol, we know what the burn-off rate is. We know what all those different factors are. But now when it comes to drugs, do we really know what that is? And we don't. I don't know if we'll ever have an impairing level, those kind of things. But how do we collect that timely through, by the time you make the arrest, and at that time, do you have an electronic search warrant system that you can actually get that quickly, get the evidence, and not be 4, 5, 6 hours into the DUI arrest and get back to that hour and a half that it used to take us?
Right.
So.
Because every hour that they're not on the road is another offender they're not catching. I think that's a misnomer. And I know we're running very, very short on time, but I think that's a misnomer that a lot of people have is they look at DUI arrest and they think that means anything. And what I tell people is it's a stocked pond out there. If you put an officer out, you can pull over a car immediately. It's the time it takes to process the arrest and the number of officers you have on the road. It's not the number of arrests that you have as an officer. It's not like there are just a finite number of offenders. Unfortunately, there are a huge number of offenders, far more so than the number of officers that are designed or that are out there to catch them. Mm-hmm. And so that's a data point that I see people use over and over again. I think that actually in the city of Austin, they use that data point to talk about how during COVID, DUI arrests were down. And unfortunately, that didn't mean that fatalities were down, that crashes were down, that the problem was gone. It just meant that unfortunately fewer officers were conducting the stops at that point in time.
And that's why I think it's really critical that we continue to keep DUI in the conversation. People can safely consume, but they don't need to drive. There are so many now alternatives through, alternative transportation systems. Each of them have friends, family, or some way to get home. And some would say, well, out in these rural counties, it's really not that easy. Well, there are other options. And if you're going to consume, then, out in those rural areas, then don't drive. And so
make a plan beforehand. Before you go to someone's house to consume, have a plan for a sober ride to get home.
Right. Yeah. So there's lots of good things that are happening, a lot that we're doing within our organization. We have so many amazing partners in this, and I appreciate, your opportunity to be with you today and talk about this, because this really, there's lots of topics out there, but the one thing that ends up at the end of the day for all of us is how do we save lives?
Absolutely. That's why we're here.
Yeah.
Well, thank you for coming on today, Darrin, and stay safe in today's times, obviously. And we just thank you so much for joining us today.
Thank you.
GDC Marketing and Ideation has deep experience in research, messaging, and creating campaigns to help change behaviors and save lives. If you are interested in learning more on how GDC can help your efforts, please contact us today.